In the name of Allah the most beneficial and merciful, welcome dear dental learners. How are you doing today? My name is Farah Naveed. I am a dental technologist from Dow University of Health Sciences. My presenting topic is elastic impression material. Let's start with the classification of elastic impression materials. The elastic impression materials divide into two main categories. One is synthetic elastomers and the second is hydrocolloids. In synthetic elastomers we have polysulfides, silicones and polyesters, and on the other hand in hydrocolloids we have reversible agar and irreversible alginate. In this video I will explain only hydrocolloid impression materials.
What are hydrocolloids? A substance which forms a gel in the presence of water. Let me tell you about hydrocolloids in dentistry. Hydrocolloid impression materials used in dentistry are based on colloidal suspension of polysaccharides in water. So, what are colloidal suspension? A colloidal suspension is characterized by the fact that it behaves neither as a solution, in which the solute is dissolved in the solvent, nor as a true suspension, in which a heterogeneous structure exists with solid particles being suspended in a liquid and polysaccharide or polymeric carbohydrate. Molecules composed of long chains of monosaccharide unite bound together by glycosidic linkage on hydrolysis, provide the constituent monosaccharides and oligosaccharide, and how oligosaccharides are formed. They are mini-group on monosaccharide. Dental hydrocolloid impression material exists in two forms: sol form and gel form. In sol form, we found material fluid with low viscosity and there's a random arrangement of polysaccharide chains. In the gel form, the materials are more viscous and may develop elastic properties if the long polysaccharide chain become aligned. You can see the animated image of sol form to gel form where agar change is done by physical, that is via temperature, and alginate via chemical change. Let's learn about fibrils and van der Waals forces. As said earlier regarding gel form about the alignment of the polysaccharide chains as fibrils which enclose the fluid phase, normally causing the gel to develop a consistency similar to gel. The greater the concentration of fibrils within the gel, the stronger the jelly structure will be. You must know about dental hydrocolloids impression materials are introduced into the patient's mouth while in fluid, means in sol form. When conversion to gel is complete, and elastic properties have been developed, the impression is removed and the model is cast. The formation of gel and development of elastic properties through alignment of polysaccharide chains may take place by one of two mechanisms. Chains become aligned and are mutually attracted by van der Waals forces. Intermolecular hydrogen bonds may be formed between adjacent chains, enhancing the elasticity of the gel. Keep in note that van der Waals forces are weak, intermolecular forces that are dependent on the distance between atoms or molecules. These forces arise from the interactions between uncharged atom or molecules. As you have gone through the basics of hydrocolloids impression materials, now let me tell you about agar and alginate. Firstly, agar is an irreversible material, can be discussed as gel formation is induced by cooling the sol. On reheating the gel, bonds are readily destroyed and the material reverts to the sol form. These materials are reversible hydrocolloids, that is agar in dentistry. And secondly, other materials. Gel formation involves the production of strong intermolecular cross-links between polysaccharide chains. These materials do not require cooling in order to encourage gel formation, and once formed the gel does not revert to sol, are known as irreversible hydrocolloids named as alginate. Uses of agar in dentistry. Number 1, for cast duplication. Example, during the fabrication of the cast, metal, removable partial dentures. Number 2, for full mouth impressions without deep undercuts. Number 3, as a tissue conditioner. Number 4, previously used for FPD impressions prior to elastomers. Now, in the composition of dental agar is agar gelling agent, borax, to improve strength, potassium sulfate, gypsum hardener, hard wax, water. And thixotropic material, coloring agent. Manipulation of agar impression materials. So dear listeners, see the image of an unique style of impression tray. Have you seen this type of tray before? Maybe some of you. Prior to use, the tube or syringe of the gel is first placed in the 100 degrees Celsius bath. This rapidly converts the gel to sol, thus the contents of the tube become very fluid. The tube is then transferred to 65 degrees Celsius bath where it is stored until required for use. This temperature is high enough to maintain the material in the sol form. This stage, the material is mixed by squeezing the tube, thus ensuring an even distribution of components. A few minutes before the impression is recorded, the contents are cooled to 45 degrees Celsius. If the material is maintained at this temperature for long, it slowly begins to revert to the gel form. When the impression is recorded, the sol is expressed from the tube into an impression tray and seated in the patient's mouth. Reversible hydrocolloids are available in a variety of viscosities, to help us achieve high levels of accuracy for use in crown and bridge work. High viscosity and low viscosity. Let me tell you about this unique impression tray, which is known as a water-cooled impression tray. A narrow-bore metal tube attached to the outer surface. The tube is connected to a cold water supply. Circulating water reduces the temperature of the tray, and lastly, the impression pouring time is within 30 minutes. Properties: poor dimensional stability, poor mechanical properties, viscoelastic, widely used as a duplicating materials in dental laboratory, imbibition and syneresis, and 3 consistency level. 1 combination with 2 or 3. 2 multipurpose. 3 specifically designed for syringe use with type 1 or 2. What are imbibition and syneresis? Agar impression is highly accurate at the time of removal from the mouth. Storage of agar impression is to be avoided. The cast should be poured immediately. Storage in air results in dehydration, shrinkage, and storage in water results in swelling of the impression. It absorbs water by process known as imbibition. The gel may also lose water by exuding fluid in a process known as syneresis. During syneresis, droplets of exudate are formed on the surface of the hydrocolloid, and the process occurs irrespective of the humidity of surrounding atmosphere. If storage is unavoidable, it should be limited to 1 hour in 100% relative humidity, by wrapping it in a wet towel, which results in least dimensional changes. Alginate use in the field of dentistry are: Number 1, it is used for impression making of partial dentures. Number 2, for making a preliminary impression for complete dentures. Number 3, for duplicating cast in the dental laboratory side. Furthermore, the composition of alginate are potassium or sodium alginate, calcium sulfate dihydrate, zinc oxide, potassium titanium fluoride, diatomaceous earth, trisodium phosphate, and coloring agent. Dear students, this composition is very important to learn and memorize for the final. It may appear in exam questions or practical viva. Manipulation of alginate impression material. Firstly, dispensing of alginate impression material. Scoops are provided for measuring the powder, whilst plastic measuring cylinders are generally used to meter the correct volume of water. After proportioning, the powder and water are mixed together in a plastic mixing bowl using a wide-bladed spatula. Rapid spatulation is required to give creamy consistency. Setting reaction. Sodium alginate reacts with calcium ions which derived from dissolved gypsum to form calcium alginate. The replacement of monovalent sodium with divalent calcium results in the cross-linking of the alginate chains, and the conversion of the material from the sol to gel form. Sodium phosphate play important role on controlling the setting characteristics of alginate material. It is important to follow the manufacturer guidelines for the best results. Using distilled water at around 23 degrees Celsius can also help achieve a consistent mix. Before properties of alginate material. Let's learn about these 2 types of alginate. Low viscosity alginates, classified as mucostatic impression materials, and they are able to record soft tissues in the uncompressed state. High viscosity is required to displace the lingual soft tissues in order that the full depth can be recorded. As discussed in previous slide, the setting characteristics can be further controlled by the operator by fixing the temperature of the water used, such as warm water, reduce the working time and setting time, and cold water, increase the working time and setting time. Please also go through the basic properties such as taste and odor, flexibility, elastic recovery, compressive strength, tear strength, dimensional stability, and of course biological properties, along with self-life and adhesion. Dear students, things to keep in mind are: for reducing errors such as permanent distortions due to viscoelastic effects, and tearing are reduced slightly by using a large bulk of material. It is normal to have approximately 3 to 5 m of material between the tissues and the tray. The model should be cast as soon as possible, in order to prevent inaccuracies due to dimensional changes. Because alginate impressions undergo syneresis and imbibition by the same mechanisms described for agar decontamination, alginate impression can be immersed approximately 10 minutes in hypochlorite or aldehyde. More options are formaldehyde or glutaraldehyde. Hypochlorite spray can be used, or poured stone cast by immersing it in sodium hypochlorite. So we reached the last slide of this video, where I'm going to tell you about a laminate technique, rarely used in dentistry. In this technique, agar touches the teeth and tissues whereas the alginate towards the tray. This technique is also known as combined reversible and irreversible technique. As time passes, the alginate material modification is seen as two-paste system, chromatic alginate, hybrid, in the form of salt-containing water, and dustless. It's time to say goodbye. I hope you have learned and understand Hydrocolloids Impression Materials. Please subscribe to my YouTube channel for more content and do suggest new topics. If you have any questions, do comment me. Take care. Allah Hafiz.